Hello everyone. Today is 2nd of May 2022, and we are in Albany. So I thought to share with you some insights about the New Zealand medical system, but also have just some shops, what they mean, show you a little bit the area. Yeah, so let's start. So as you can see, some of the shops, I don't know all the shops, but you have like Tank, it's like a smoothie fruit shop. Gastronomy, it's like a Russian shop that can buy different Russian products. True Color, it's like a paint shop. And they have some restaurants here as well. And Tony's Tires is just a tire shop. I'm from all that, I usually use the gastronomy because there I can have like a roasted buckwheat, which you can't find roasted buckwheat kind of in most places. And here in Albany they built just, I think quite recently, it's kind of a new area. You see like these apartment buildings, and also there is some fields, kind of cafe. Still haven't been there, and you have some stuff that they kind of building here as well. So a lot of construction going on in Auckland. Yeah, and of course the Stadium of Albany is on the right. So at the moment we are heading towards the shopping area, which is quite big in Albany. We have the Westfield Mall also quite big. Yeah, so you have these apartment blocks that actually not all of them are occupied. You have offices downstairs, and you can ask if you want a short-term rental or also to buy. There are some apartments that are for sale, or you want kind of long-term rent in this area, which actually quite nice, these new buildings.
What is the short-term and long-term in New Zealand?
Yeah, so short-term is just maybe a month or 3 months, 4 months. And long term, it's just you know, at least a year or 6 month fixed contract, and even more. While we are heading to the shopping center, I just talk with you about the medical system in New Zealand a bit. So when you come to New Zealand and you have at least 2-year work visa, then you're eligible for public service, public medical service, like as a resident or a citizen. So that means you can go like for the emergency room and to the hospital and eligible for medical help. But it doesn't mean that you still not paying for like family doctors, called the general practitioners here. And general practitioners here, like the prices that you paid for them is varied. Of course, you have some insurances that kind of pay you back the GP visits and things like that. But let's kind of not talk about the insurance at the moment, but just, you know, the basic eligibility for medical services here. So people who, for example, who don't have 2+ year visas, they need to have like a private medical insurance who kind of give, like, return some of the money back. Depends on what depends on the cover. Yeah. So here what you need to do if you want like a family doctor like you have in your home country, like in the Western country, so you find a GP clinic who actually accepts new enrollments, because if you're not enrolled you'll pay way more for your doctor visits. Can also cost like $150 per just 15 minutes visit if you're not enrolled, and when you're enrolled it can go down to $30–40, and you have some very kind of affordable but not a lot of clinics that you can pay $25 for 15 minutes of GP consultation. Yeah, Luba just showing this is like a there is also a pool over here. Actually, I haven't tried that. Yeah, and the left you have the movies and the mall itself. Yeah, so when you go to the doctor, you do the examination and everything on file, and for example, like if you need a prescription for medication or something like that, most of the GPs don't have the medications and the pharmacy on site. Some of them have, but if you need a medication that requires prescription, you can go to the general practitioner and he will give you one. And of course, for the prescription you pay as well. Can cost about $20 to $30 per prescription, even if it's like again and again repeated. So let's say you need the same medication again, so you don't need to visit the doctor, for example, because for example myself moving often, and let's say my practice in the South Island, for example, so I won't go for a visit. Of course you can do online visit, but sometimes if you have the same medication and need again, you can easily just email the GP practice and ask them, can you please repeat the prescription, and then send the prescription itself to the medical center or the pharmacy that have your medications, and then you can go and collect it from there, and can be anywhere in New Zealand, so it can be quite easy, and you don't need to do a GP visit again unless the GP requires you in order to renew the prescription. It will require you to have a kind of consultation again, but not often. Yeah.
Before taking the medication, you need to give a call to the pharmacy or medical center to be sure that the medication is in stock. Otherwise they can order it for you and you can take it, like say, in a couple of days.
Yeah, that's a good point. So check before asking the GP practice to send you your prescription. Just check with the pharmacy you want to collect it from, if they have your medications or whatever you have. So that can save you a bit of time. Yeah. Hello.
Hi.
Yeah.
Yeah. How are you? Yeah.
Yeah, so this is the warehouse. Warehouse have a lot of things inside in quite affordable price. You can find there from food till clothes and bicycle stuff, and yeah, like almost like electronics, TVs, like little bit by everything. So of course the quality there mostly not the best, because it has to be like a affordable retail that has kind of everything but in a kind of affordable prices. But it's quite good to come to a warehouse if you need some stuff, like, you know, some beddings and things like that. So it can be quite good. The yellow thing, it's a Pack and Save. It's just a grocery shop that actually have quite good prices on food. Yeah. Okay, yeah, let's get back to the GP practices. So another thing I want to mention, it's not always easy to find a GP practice will accept you. What do I mean accept you? They can say, oh sorry, we don't have space, or we have too many patients, or whatever. So when we've been in Christchurch, we actually struggled to enroll to GP practice because they just overflowing with patients and customers and all these things. So
And you need to be enrolled in your area where you live in.
So in my opinion, like what the GP practice are saying, oh, we just accepting patients from our area. But like I understand, it's just an excuse, kind of say, oh, we just can't accept you. And it's quite a smart excuse, like people won't get offended. Oh, you're just not living there, so what can I do? Yeah, so that's something in Christchurch we kind of struggled to get a GP practice, and eventually we got a GP practice, but it wasn't an easy thing to do. In Auckland this is a bit easier because you have just more options, you know, like it's because it's Auckland. And of course in the West Coast, in Westport, during the whole year they've been there, we just couldn't get into GP practice at all. It was only one GP practice and the other one was the hospital, but because we worked in the hospital, we didn't really want to enroll to the GP practice over there.
It's a privacy matter.
Yeah. So that was kind of a bit hard thing to do. Yeah. So, for example, Chemist Warehouse, they have a lot of medications on site. And this is, well, like one of the places, the pharmacies you can kind of get and take the medications you need. Alright, so we just been out of the pharmacy, and apparently there is a new thing called, that we didn't know, called Section 29 Order of Medication. So I, for example, called before to the pharmacy and asked if they have this specific medication in stock, and apparently they said that they have. So I came, and then they said when I came that, oh, this medication is not available, you need to wait 2 days. And I kind of tell them, wait, but I called and they said you have in stock, you checked on the computer. I said, no, because it's Section 29 and all the thing. So what you can do, call other pharmacies, see if they have these medications, and yeah, so it's up to you. So, okay, so we called some pharmacies. So none of the pharmacy actually had the medication. They said they need to kind of order it, and one pharmacist actually said, oh, actually I don't want to deal with that with Section 29 because it will cost me too much money, just go to Chemist Warehouse medications pharmacy and just order from there, just like that. And that's what I did. So yeah, so apparently some medication just you don't have available, and sometimes the people in the pharmacy can make mistakes that, well, actually happening quite often, but they're trying their best. Yeah.
And what does it mean, Section 29? In a specific medication, or
It's just some kind of order process, internal order process that kind of costs more money to some pharmacies, so not everyone wants to deal with it. Another thing I want to talk about, dentistry. So dentists in New Zealand are quite expensive. So the biggest variety of dentists, of course, you have in Auckland, and the more you go to more remote places, of course, you have less doctors and dentists, and sometimes the quality of the doctors doesn't mean that they will be lower. Sometimes you have good doctors, even it's like isolated place. But sometimes you don't. But the dentistry costs quite a lot. Not affordable like in East Europe or in Asia, and a lot of people actually go to Asia or like the islands to and go and do the dental care. But of course, depends. If you have emergency service, you need dental care, you just don't have a choice, but it is something that you need to be aware of. And of course, dentistry for children here is free until age of 18. Yes, another thing I want to mention, that there are different prices for different age groups. So you have most of the GP visits also, like for underage children, are free, but adults need to pay. Also, if you're with like a resident and you are receiving a benefit and you have like what's called community services card, you can have like more cheaper GP visits, sometimes like a 50-70% less. Yeah, yes, yeah,
Around the sun.
yes, because it's poison. Again, yes, it's chemtrails. Yeah. Anyway, so other thing I want to say, whoever comes to New Zealand, there is what's called accident compensation cover, like ACC. So that means that everybody who have like a sudden injury or accident are covered by this insurance, and that means even if you don't have, if you're not a resident, you can be covered by that. Yes, as you can see, really bad news. A lot of chemtrails and poisoning are going. It's actually the chemtrails in New Zealand are persistent, but they are not actually really often as in some other countries. And it's sad to see that this air pollution is going on in a nice country when the air is so great here. Yeah, so this is like this apartment complex a bit closer. You can see like nice balconies, but quite small. You can see our first trolley. So why I came here is because I wanted to show what's kind of happening. So let's get to the trolleys. So because this apartment place is quite close to the shopping center, including like groceries, so people kind of taking the trolleys from the shops and not returning them. So as you can see, every day you have more and more trolleys that are gathered here. So in some countries, like Israel for example, they already made a solution for how the trolleys are getting back all the time, or this problem not occurred. But unfortunately in New Zealand this is not happening yet. So maybe in New Zealand shops can get advice how to do that. But I must say most people actually are like returning the trolleys, but it's like the first time that I see that people kind of not returning these trolleys. And of course, like you take your items from the shop and then you take the food, and then of course you won't go all the way back. So you have piling up of trolleys over here, and still solution not haven't been found. So yeah, so from my perspective I have no idea if I should do something or but yeah, just interesting. Like I never seen it in New Zealand that this thing happened. So most of the trolleys are from Pack and Save, from the grocery shop, some from the warehouse, and some from the other New World. But as I see, probably soon Pack and Save will have lack of trolleys. On the other hand, maybe we can go to Pack and Save and talk to the manager and ask them what they're thinking to do with this thing. Oh, that can be interesting.
Payment trolley like in Israel.
In Israel it's genius, like you know, you need to pay and they all kind of
Only 10
yeah.
cents, and people very disciplined regards to put it back.
Probably not 10 cents, maybe it needs to be like a bit more.
$1 probably.
Maybe, yeah, I'm wondering if $2 will help. Maybe $2 will help, but maybe some people won't care about $2. But in Israel it's like 5 shekels, so they will. So that's also like a nice artificial lake. So we decided eventually to go to Pack and Save and talk to the manager and ask them what are they planning to do with the trolley thing. You see, there is even a trolley kind of drowned in this lake. So you have just, you know, some unusual behavior towards trolley here in Albany. Really interesting. Yeah, so we'll go to Pack and Save and ask the manager what they think of doing with this matter. Cinema place on one of the other sides of the Westfield Mall, and there you have like farmers, also like a shop like Mashbir Tzarchan in Israel. You have just a lot of clothes and some home stuff. Under the Pick and Save car lot, you see this are the same trolleys that people live in, but here the employees kind of gather in the trolleys, but I can see less and less trolleys available over here. So just in a minute we'll go talk to the management and see what they will think about it. Hello, hi. We have some trolleys
in our area where we live in.
Yeah.
Do you know about that?
Yeah, we know that.
Yeah.
I've been over at the moment because we've been busy.
Yes.
So are you going, how are you going to solve this problem? Because people always grab and leave it out of the shop.
I let my boss know.
Yeah.
Yeah.
Yeah, I let him know about that.
Okay. We just managed to talk one of the supervisors, and so they said they can manage only what people are doing in the ground. So when they live in the grounds, they actually have no power, so they kind of rely on people behaving well and returning the trolleys, which in my opinion is kind of showing itself as completely useless. So these trolleys will continue to gather more and more. So we kind of told them about the systems that are available and kind of said, oh, they don't have this system in place yet, and so no kind of appropriate answer what will be done with it. But
yeah, so you can see it's a part of the culture and mentality that businesses trust public and they rely on their good behavior and being good and follow the rules. And actually people in general are really doing well. They follow the rules. They're very so yeah, they are fine with rules and follow orders and everything. But in this case I guess people getting naughty because they don't want to go far away from their apartment, just use trolley. And another
thing I want to mention, that most of the population here in Albany is actually Asian. So you can see probably the difference between behaviors. Like, it doesn't mean that I know all the people who actually live in those apartments, but you can also assume that because there is cultural difference, like most of people who live in here are Asians, you can see this pattern of behavior. So yeah, who knows, we will see in a month's time how many trolleys are going to be there. See under these apartments a lot of empty office buildings, just waiting until someone to rent them out. Yeah, and this really nice and lovely evening environment, so the sun setting soon. It's becoming a bit colder. As you can see, very relaxing days here in New Zealand, as it's probably every day mostly like that, except in COVID times, but now it's quite quiet. Oh, there is another trolley. Yeah. So thank you for being with me this short journey today to the shopping area and what we discovered about the social issue regarding trolleys. So here is a big parking lot for trucks, but actually I can see some people actually living here. For example, this person, it's a motorhome, it's not a truck, and people are living here permanently. So I see this person at least a few months, and there's a bus over there that lives for a few months, and a bus over there that lives a few months, and also some more motorhomes. So some people living here permanently. and some kind of moving back in there. But for example, that nice motorhome, oh, this motorhome probably cost thousands. Yeah, so really nice. Yeah, and people doing kind of drifts in the car over here. Yeah, I just wanted to show you. Yeah, so we ended this kind of day to day with small walk in nature. So see you around next time.